from Georgia. For what purpose do you seek recognition?
Mr. Chairman, I move to strike the last word.
Gentleman is recognized for 5 minutes.
Mr. Chairman, I'm pleased that the committee is moving on the Advancing Care for Exceptional Kids, the ACE Kids Act. Back in July, I met with a young girl and her family visiting D.C. to share their care story. This young lady had Down syndrome and cerebral palsy as a result of brain damage from a benign brain tumor that was discovered in utero. I keep a picture of her and every child that I meet with these complex medical conditions in my binder as a daily reminder of why I'm here and why it's so important that we bring up life-changing bills like this one. Meeting with brave children like this young lady made me proud to co-sponsor the ACE Kids Act. This critical legislation improves how care is delivered to children with complex medical conditions by addressing coordination of care and fragmented care across state lines, as well as gathers national data to help researchers improve treatments for rare diseases. I look forward to passing this legislation out of this subcommittee to the full committee and then on to the House floor. Thank you, Mr. Chairman, and I yield back.
Chair thanks the gentleman. Gentleman yields back.
Mr. Chairman, I move to strike the last word.
Gentleman is recognized for 5 minutes.
Mr. Chairman, I'm pleased that the committee is moving swiftly on my discussion draft prohibiting gag clauses in group and individual health plans in addition to Medicare Advantage drug plans and Medicare Part D. Often, gag clauses are part of a take-it-or-leave-it contract where the pharmacist has no other option if they want to continue providing care for patients in their community. As the only pharmacist currently serving in Congress, I can remember having to hold my tongue as I watched patients after patient struggle to pay for their prescriptions, all out of fear of PBM repercussions. My legislation would allow pharmacists to properly advise their patients on the option to potentially spend less by paying out of pocket rather than with insurance. Banning gag clauses has received national support from state legislatures, both chambers of Congress, HHS, and the President. I want to thank you, Mr. Chairman, for holding this important markup today and for including this discussion draft. I look forward to passing this legislation out of this subcommittee to the full committee and then on to the House floor. I thank you, Mr. Chairman, and I yield back.
Chair thanks the gentleman. The gentleman yields back.